My goodness. Hey, happy Wednesday, everybody. Thank you for tuning in. If you don't know me, my name is Mike Asherbranner, professionally known as the Redneck Connector and proud and humble leader of the Hounds of Business community. And woo, Murphy's Law is in effect today. Anybody else feeling that, or is it just me? I blame the solar flare. All right, I'm a space weather nerd, me and Sarah Puccio. But yeah, welcome. I'm glad you guys are here. And boy, today is going to be stellar. I mean, every day I say that because it's dadgum true. But we're going to be talking about a topic that affects pretty much everyone. I mean, if not everyone, right? Fixing healthcare's hidden leak, doing more with less without losing what matters most. We all have ourselves, people, loved ones. We got to caretake. People are dealing with issues. Uh, clinics aren't getting paid what they could be. It's just a mess out there. And it's not that we have all the answers, but there's two people, veteran entrepreneurs, Beverly Neal Clinton of Healing for Wounds, and Tim Murat, which I probably messed that up, but that's Revenue Doctors. And we're going to talk about it. They're going to reveal how smarter systems, stronger ethics, and a mission first mindset can help providers, professionals, and families thrive even in times of chaos. So we're going to have a real good chat. Feel free to chime in. I'll be asking audience questions as usual. And there she is. Let's bring her up before we bring up Tim. How are you?
Living the dream. How are you, Mike?
You Murphy's Law, right? But hey, it's my turn. Nobody's immune to the stuff. I blame the solar flare. That's the big solar magnetic. I'm a space
Oh,
nerd.
what is it? What is it? What is it? Three
G4.
I 3 AI Atlas.
Yeah, it's big, and I'm just gonna blame it. I don't know
Let's
what
let's
else.
go with that. Let's go with that.
But I just introduced you and what Tim's going to be talking about. And I'm excited about this because it affects everyone, everybody. Even if you're not in the medical field, you're not a doctor or a clinic, we're impacted by it. So we don't have all the answers, but we have a lot of good answers and we got a lot of good direction. And I can't wait to share and talk about that with you and Tim.
Mike, it's always a pleasure to be here. To say that you are integral in our success is an understatement.
Oh,
You saw our vision, and it wasn't like we needed to do breadcrumbs. So for that, we're grateful to be here to have another wonderful chat.
yeah, I didn't know she's going to say that. See, I'm going to blush like a little country tomato. Thank you. But it's an honor. And again, this is how we get down. I got introduced to you by Agape. I believe Gape Garcia, right?
Hmm.
Confrontingdv.org. So if anybody wants to
Hmm.
support that, confrontingdv.org is doing amazing things. And I met her through Tanya. Right? It's just, this is a snowball effect. So I'm going to say it now and a couple of times. Don't do this by yourself. Building a business is hard. Now we got a trust deficit to overcome on top of building a business, right? And doing good things.
Hmm.
So, hey, if you want to reach out, you want to know more about what we're doing, how to plug in, you can go to a group call. We can stick you into a networking just to test it, like the old lady with the sample of the sausage at Costco. It's just come in, check it out, right? If you like it, we might talk more. If not, I don't waste time. And but this is how it gets done, folks. I didn't meet these folks. If I had DM these people, they probably would have pepper sprayed me over Zoom. But I got an introduction, and that made the world of difference. And so here we are helping each other. So Leanna, good to see you. Who we got? Oh, we got them piling in now. Okay, I could talk less and do more. Uh, Yolanda. Yolanda knows I get sad if she don't come into the show. Like I expect it now. So thank you, Yolanda. She does that for us too. She is a mega star. We got Homer. Thank you, Mr. Homer. Good man that works hard. Royce Blake, radio voice. Uh,
Oh,
welcome, welcome. And then Charles Caldwell. Hey, good to see you always, my friend from Hong Kong. I got some friends in
wow.
Vietnam. I got to connect you all right, business people.
Wow.
So let's give a shout out.
An international crowd. All right.
Yeah, that's because of you. You an international lady of mystery right here. Yes, ma'am. So I'll tell you what. All right, if you missed it 2 weeks ago, I get excited. I don't go. I check the mail and nothing but bills and junk in there. And so then I opened the mailbox and wow, I felt like Christmas time. So I got April Wyatt went to her Tomo tour in Japan. So
Mm.
that's the first one, right? So she sent me a postcard. Funny thing is, she got back and then the postcard got here. She got back before the postcard. Yeah. But they had a wonderful retreat. They have a Bali retreat coming up next October. I
Mm.
think I might leave my house and go to Bali. That's a big statement.
That's a nice destination. And that one is on my bucket list. And it goes till next year. I've got time.
Oh goodness, yeah. See, we can all go. And the Hounds one, we're going to plan a retreat. So,
Mm.
let's plan that one out. And then we got Baz Porter, Cracking the Rich Code. That was forwarded by Tony Robbins and had, endorsed and all this. So Baz sent me a bunch of good books. He's been instrumental in helping me and the Hounds grow. And then finally, Colleen Stubbs. She sent an amazing card. And she is also a power partner and sponsor of HOB. And I'm telling you what, folks, if you know anybody like that, send me 3 more because we are exploding. So again, we're not the only option, but I did want to make sure I gave a shout out to these people. They're leading in the Hounds, they're practicing it, and folks are seeing it. It's just absolutely amazing. So whether you're in healthcare, STEM, meditation, it don't matter. You're building a business, you want to help people. Dadgummit, there we go. So that's the shameless plug. But I want to give them a shout out for all they do. And they're just really thoughtful folks. So connect with these folks and you won't be sorry. So you ready to get this party started? Because Tim probably fell asleep back there. No, I would have. I don't know. Tim,
No. Tim is always wired for sound. He is nowhere near sleep. Not yet.
no,
It's close,
no.
but not.
Oh,
Yeah.
he's a tough dude. Yeah, man. And by the way, yesterday was Veterans Day. So thank you and Tim both for your service and sacrifice. Appreciate you all immensely and all the service members out there. We can't do enough in the HOB for the veterans, all right, and active military and their families, because boy, they go through it. It's a whole family team effort there. So hats off to you, my friends. All right.
Thank you, Mike.
My pleasure. But let's run the video. See, now I try to use the fancy tools. All right. So the folks who know me in the comments, I try to use the fancy tools and everything disappeared. So yeah. And you go to Showtime 20 minutes and go, where's everything at? So we're going to watch the new video. We're going to pull Tim up and have a great, meaningful convo, folks. Let's do it.
Looks like your business might be in a bit of a pickle. Don't you worry about a thing. You ain't alone in this. You're just a success story waiting to happen. Trust me on that. Every bump in the road is just an opportunity wearing a clever disguise. Welcome to the Hounds of Business community, where we don't just sit around twiddling our thumbs. Nope. We turn those obstacles into mighty fine stepping stones. This here's a place where high-level entrepreneurs and sharp professionals gather to grow their businesses and mindsets, kind of like how a good old gumbo needs the right ingredients to be something special. Ideas thrive here, and collaborations, well, they're as natural as sweet tea on a hot day. Success, it's a journey, and we're fixing to walk that road right beside you. Now, don't forget to follow us on LinkedIn for all the latest tips and insights. We're talking about the kind of wisdom that'll keep you ahead of the game. And while you're at it, head on over to our YouTube channel. We've got ourselves a treasure trove of videos, from expert interviews to webinars, everything you need to stay sharp in this fast-moving world of business. The Hounds of Business community? Well, we ain't just a network, we're a movement. So why not come on and be part of something bigger? Join us today and let's turn your business journey into a real Southern success story. Together, we'll achieve greatness, just like crawfish and singing on a Friday night.
Okay. Well, Beverly, do you know about crawfish and singing on a Friday night?
Surprisingly, yes, I do. Thank you very much. I'm from South Carolina. Come on now.
That's why I asked. I was like, you do. Let's find out where Tim. Let's pull Mr. Tim. How do you say the last name? Well, first of all, you're pulling a mic, right? You're on mute. That's my fault, y'all. I'm contagious.
Okay. It's Murray. Think buffet.
Okay, the one time I don't try to go French on that name or a name like it. I said Jesse Doubleur the other day, and it was Doback, right? So I'm always wrong. So I try. So anyway, Tim, how are you today, my friend? Tell the folks what you're doing, what company you represent, and how'd you meet Beverly?
Well, Beverly and I met years ago at a gun show, mind you.
There you go. That's military for you.
Oh, I was helping people get
Speaking
legal
the truth.
representation if they are someone who has a concealed carry permit. And I'll let Beverly tell you why she was there.
So because I am a serial entrepreneur, I had another partner, and she's a redhead who is just like every other redhead you know. And she was like, Beverly, we're going to go do gun shows. I'm like, no, we're not. I'm not going to no gun shows. And she was like, no, go. It'll be fine. It'll be fine. And long story made short, I did. I ended up making some really good friends, but that was not my first choice as a venue because one of my other businesses was a mobile notary. And same thing with Tim. There were people at the gun show who needed to get some of their documents notarized or do fingerprints. And we were doing fingerprints at that time as well. So they could get the concealed carry and I could do the fingerprints and the notarization. So it was a good mix. But Tim was like, Beverly, we need to get together. And I'm like, COVID hit.
Yeah.
Kinked it all.
Here's what I like about you. You just go everywhere, be you, and you pick up guys like me and Tim. You know, like you attract every good person everywhere.
I'm not sure you said that quite right, Mike.
All
Don't
right,
give him an inch. Do not give him 1 inch, not one.
Okay, so if you're a doctor or a medical professional and you thought this show was going to be stuffy from the start, put that in the chat. I want to hear that. And also, don't be shy. All right, we have fun, but we get down to business, right? We're serious. We got serious topics, and but we got to have fun. Otherwise, you might as well just work a job, a regular job. So, all right. So I'm so happy already. I can't even stand it. All right. So let me get my bearings down today. All right. So again, the title today, Fixing Healthcare's Hidden Leak, right? When you hear that phrase, Beverly, what comes to mind first for you personally?
Oh my goodness. Being creative and being resourceful because, there's I've got so many stories that come to mind when I think of mind over matter, because sometimes the resources aren't there, but if you've got the mind to make a change, you can do it. And that's what we do. We understand that there are many people who are frustrated within the medical field. And so we're looking to build a community. I mean, a trustworthy community where everybody wins because we know it's possible. You'll also hear me say a lot of my colloquialisms from my grandma. Like my grandma used to say, you don't know what you don't know. And that's what we feel like here. We feel like that there's just information that's there that can help people. And it doesn't cost you anything. You just need to be aware of what's out there. So that's what we do. We're really looking at revamping and creating community here.
Well, that's music to my country ears, right? That's what I'm all about. And that's what's beautiful about it. It doesn't have to even be formal. It's just a band of people that are trying to solve problems that just aren't going to get solved on their own or from traditional methods, or they haven't for decades, right? So it's nothing political, whatnot. It's just solutions from the private sector and people who band together. All right, that's what it is. So Tim, I'll ask you too, my friend. When you hear that phrase, right? Fixing healthcare's hidden leak, what you and Beverly are doing in your businesses, what comes to mind first for you? Why is it important, man?
It's not a leak, it's a flood.
There you go.
Every year, we're having doctors lose contracts with carriers terminating the doctors terminating the carriers. They pay slow. They don't want to approve things. I mean, we hear all the nightmares. And the reality is it's mostly because people don't know how to navigate the system and they need someone who does.
Yeah. In fact, y'all, like I can work with a lot of people. I mean, oncology nurses, people who start their own. And I had sat there on a group chat a long time ago, not too long, about a year ago, and watched these seasoned professionals couldn't even figure it out for themselves. Like they had to go through the system, the red tape. And I'm sitting there going, if these seasoned professionals can't even do it, how am I supposed to do it? How's grandma going to do it? Right. And it's seriously, it's not picking on anything, or I want to make that clear. We're not getting political. We're not getting weird. All we're saying is that this is important. Health is the importance, and it's really hard, difficult, and sometimes impossible. And then the people who go to school, then now that system's complicated. So now they're not getting paid. The clinics aren't getting paid what they could get paid, but nobody can figure it out. And that's the general overview. It's not exaggerated, right, Tim? That's just
Medicare is complicated. And I just went on Medicare. I'm 65 now. And I can see my own cognitive decline as I get older. And so I'm thinking when I'm 80 and 85, how does someone that age, if I've already got if I've
Right.
got cognitive decline at this age, 20 years from now, how are you staying sharp and how can you keep up with all this?
Well, you can't, and that's why people are doing real things and real solutions, right? And it's sad because I mean, it's not even just cancer. I mean, sometimes I face it just going to a doctor's visit or having the kids or there's special medicine, and now we got to wait 2 weeks to get that's not something you wait 2 weeks for. It's not a vacation at Bali, right? That's important. Go ahead, Bev.
Well, and
Well, that's how come I say we're building a community, because we like the fact that we can pick up our phones. We like the fact that the people who know us are very comfortable in calling us and they trust our advice. We actually hold ourselves accountable. And I think we have to be, or at least that's how we work. That's how our companies work. We value, we really do search for solutions, and we search for win, 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 not like cutting it off and you might kind of get it. It's like slightly discounted. No, it's not any of that. The quality is still there. The quality of life is improved. And all you have to do is just show up. That's it. Just show up.
Well, look, if you don't mind, let me ask this, because I'm imagine people want to know this, and at least your perspective. Because I would say we just covered it. Most Americans feel like the healthcare system is broken, right? And people inside and outside the system constantly, right? There's a lot of innovation, like you two are doing, but cause to confusion. That's the best way I can put it. So, what do people inside the system wish the public really understood? Is there something that because sometimes maybe we get mad at our doctor, but your doctor's for just as frustrated as you are. Those kind of things. There's something that people wish that the public knew, like we are actually trying to make a difference, just difficult, or is there anything? Well, Tim, we're going to go to you because I think either Beverly.
Yeah, she froze again.
That's right. She'll come back. She's like me when a bird flies over.
Well,
so
here's our basics. Well, she's in Los Alamos and they're having real issues up there. With somebody cut into the fiber optic line up there yesterday. I mean, here's what I see. Our system is treating the symptoms. The general rule is let me write a prescription for that. In fact, my own doctor, we were talking about, you have to be a little vivid here, but enlarged prostate and its effects. And she told me, well, I can put you on tamsulosin and you'll get the problem fixed overnight. Or you can go do saw palmetto and it'll take you about 6 months. Guess what most of the people would pick?
right.
Not the herbal remedy, but the other. But the pills have long-term effects on our kidneys and all kinds of other things like that. And we've become a culture that all we want to do is take a pill to solve it, not invest in the exercise or the cleaner living, or stop eating ultra processed foods, or make sure we eliminate microplastics from our diet. I mean, a study just came out in the British Journal of Health, or whatever it's called, that was done in conjunction with the Norwegians, where they said the primary reason that colon cancer is on the rise in 30-somethings is ultra-processed food, aka Takis or Flaming Cheetos, and microplastics.
Wow.
Well, David Manesky, he's always talking about these things, and some people go, but he's right. And I heard multiple people in healthcare here recently. I've interviewed some, and they're like, somebody explain that one to me. Like, you just go out there and crush some. What is that about? Did I freeze?
You froze, and we didn't understand what you were talking about. You came in at the end and said, I want to crush it. And that's all we saw.
Here's what's happening, you guys. There is between the solar flares and the amount of energy that we are cooking up in here, we're blowing stuff up. We're just blowing it up.
I'm serious. That solar flare stuff ain't a joke. Like it's a real big, geometric storm. You see, you're like, what's going on in here? Yeah, I like space weather. I geek out. So anyway, you're right. It's a lifestyle. It's a lot of things, but even then, when people come in to get help, it's just disastrous. It's sad. It's very, very sad to see the navigation. But I'm glad the people and companies and doctors out there, they're really doing their best. They're really trying. They didn't create this system. They're not in charge of it completely, but it is refreshing, right? And we know a doctor. I'm not going to call him out. He'll be out here soon. But we know a doctor's been all over national news, and he's doing a lot of innovative things. So I love seeing that kind of grassroots, hey, let's do something about this, right? And I love that. It's not political. It's not in the weeds. It's just saying, hey, we got to do something. And then I brought Dr. Eugene Manley in, because I don't know the inner workings of healthcare. But here's what impressed me. I introduced you to Eugene, and Eugene don't play. If you don't like something, you're gonna know it, right? He's a very honest man. And Eugene started working with it. He said, "Oh, this is great." And I'm like, "Well, that's all I need to hear." Right. So
Well, I'm going to tell you
yeah.
something else. We also have another doctor who's on our team, and he was on actually a wound care council. He came out of retirement to work on the team because he believes in what we're doing. Uh, Especially with him having that background in wound care, he saw how what we were doing was making a difference. I jokingly say that this is Star Trek technology, but between the technology and our areas of expertise navigating the Medicare system, we're able to help doctors' practices so that those doctors can focus on their medicine, and we can generate revenue for their practice so that they can continue to do what they do best, so that their people get healthy and then they go back into the community. And we create a win-win-win. It's a synergy. It's like a domino effect. Once we get one going, then it goes back and then
Yeah.
it just blows up.
And I've noticed that, and that's fun, because when other doctors recognize what's real and substance and what's not, because there's a lot of scams and stuff out there in this industry, just like anything else, right? Or confusing jargon or whatever. And you guys are really good at making it plain English, right? I understand you. That says it all. I'm not a dumb guy, but I don't know anything about healthcare. Let's be honest, right? So that's very important, because you're speaking the language and people are resonating with, hey, that makes sense. So let me start with you, Beverly. I'm going to get, and then I'm going to get with Tim at Revenue Doctors. But you talk about the hidden leak, which, Tim, it's hard to argue with, says flood, right? Where clinics and skilled care facilities literally lose money and patients fall through the cracks. So, and we talked about this before. I'll take your liberty with this. But what's actually happening behind the scenes? You were saying that, like, some malpractice and stuff almost costs more than the daggone revenue coming in and all. Yeah, enlighten us.
Yeah. So I'm going to talk a little bit more about New Mexico, but we've got 42 different agents all over the United States.
No, 73.
I'm sorry, Nick, that's 73. See, we're growing. We're growing. I was at 42. I need to wake up. I lost like 20 people. Anyway.
Get that abacus out.
I know, right? Or more fingers and toes. Yeah. So what we're aware of is that here in New Mexico, we have a lot of lawyers who come in from out of state, and then they sue, and then they take that money back out of state. They don't leave it here. So you have these, and before I did this, I was a court reporter, so I'm very used to the judiciary, but I'm also used to reasonable judgments versus some of the things I've seen here lately. So when you talk about the leakage or the floods, there are instances where, Tim, I think it's about 90 to 95% of doctors, would you agree with me, have left over like at least $100,000 on the table, at least?
Wow.
I don't know if I'd go that rich, but it's pretty high.
I know it's more than 80.
They're leaving money on the table. The rate at which they're doing it will vary by practice.
Right. And that's why I said a average of 100,000, because we've got some that are lower, and then we got the ones that are like at 9 million. So when we look at doctors who are leaving revenue on the tables, it's only because they don't have time. I can't think of a doctor's office that I've called where they haven't acknowledged that they're short-staffed. So we know that they're short-staffed. So we're trying to put them with the resources that they need in order to continue to do what they do best, which is focus on patients. So if we know that there's a leakage, we can go in and say, look, here's what we know you left on the table last year. Now, here's what we can also show you. Here's what we can do to show you how to get that back at no cost to you. So what does that do? That now gives you more revenue, which maybe, I don't know, maybe you want to pay your staff more because they're certainly working harder.
Right.
Maybe you need some other equipment. Guess what? You can now afford that. And for the medical malpractice, and Tim and I went to a hospital in a rural area, and their medical malpractice last year was $300,000. This year, that same practice, the medical mal was
Same
at
hospital.
same hospital was at 1.3 million, and the hospital only brought in 1.6 million. So when we look at those doctors, we see where those deficits are. We go back, we capture those funds, and then we go back and we say, okay, now as a result of that, here's what else we can do to help you generate revenue and again improve your patient's quality of life.
You got to run a rural. No, let me get this right. You would have to run a rural clinic, a hospital for the year on that kind of spread.
Well, the sad thing about rural hospital systems and doctors, they can't make it on their own in those rural communities, but they are the lifeline to those communities. And small towns are near and dear passion-wise to me, and we want to go make a difference in those small towns. In Texas alone, I think they've had at least 10% of their rural hospitals closed in the last 5 years.
And there's not many to start with. I mean,
in Texas there are because they've got so many counties. But
yeah, well, if that happened here, I think we have 10, maybe the whole state, or at least half of it. It's sad.
Here we probably have about 15 to 20 in our state. But what it is each hospital or each county years and years ago built their own hospital because that made them a more viable community. And now they can't survive.
Now, I know it's a little bit of left field, but it goes to Beverly's point, and maybe you know something about it. I have a friend of mine. I got to connect you. See, now you're seeing the Hounds in action on the live stream, right? We're going to connect you with somebody. She works for the business development of a law firm that all these state and federal laws, right? They got it. So you got a surgeon who does a $10,000 surgery and they only got paid $300. They could get reimbursed, but they don't know how to navigate the state and federal systems. Wow. Yeah, and like, why would you? They went to medical school. They went to debt, most of them, right? Like, so
they're
they
still
have
in
been.
debt.
Yeah, it's not the doctor being shady. He's just trying to get paid through the systems and health insurance and everything else. So, I mean, the thing is just bonkers, right? And this is what we're talking about. You two have two specific things that you guys do, right? So it's healing for wounds, but it's much more than wounds, right? And then Tim's got a lot of things going on. I want to dive into it a little bit. So Tim, from your view at Revenue Doctors and all the things you do, man, what are most providers bleeding revenue and not realizing it? Where are they bleeding it?
What we're finding is doctors are not meeting the quality metrics from Medicare. If you don't meet your quality metrics at an 80% level, they will penalize you 9%. So you're losing money there. And then many of the Medicare Advantage companies, and in some cases specific things with Medicare, you'll get bonuses for meeting your quality metrics. That's where they're leaving money on the table. The 9 million Beverly referenced is a 35 doctor group in San Antonio that's leaving 9 million on the table a year. And this is their own data. It's as much as 15 months old, but it's a year snapshot of what you did and didn't do.
Wow. I thought I froze again. This is a fun show. Solar flare. Well, let me ask you this, if you can cut to the chase, because I want people to know that you guys have helped real solutions, right? And before we get to Baz, because he asked a good question, can you share a real life example of a facility or a business that turned things around once they fixed that leak and flood? Like how are you guys practically helping this, and what is happening when people figure it out, Tim?
We've had a new insurance company come to town, and they won't take a doctor without a 3-star rating or better. So I've connected with one that has 1.4 stars and can't get on that with that company. I'm in the midst of turning them around. So this is a slow shift. This can take 2 to 3 years, Mike. It doesn't happen overnight. So I don't have somebody we've completely turned around,
Right.
but we have people making extra money already, but we haven't. The thing is that patient satisfaction scores go up with this process, and the doctor's actually doing less and the patient thinks they're doing more, and they're getting paid better, and they're saving staff time of calling people up trying to get them to do the things they're supposed to do from a preventive standpoint that nobody wants to do, which is why we're only about caring for the sick, or as Baz was saying, sick care. We just don't, we're not focused on taking care of our own health in any other way than taking pills.
Right. Well, and we had several great comments about that. Like, hey, and oftentimes not one or the other. There are things that, vitamins and yoga can't cure, but preventative measures and doing things well, that's going to take a lot of the onus off of relying on just pills in the system. Right. It's independent.
Well, I've been taking garlic and my cholesterol's down. And instead of taking a statin, which is incredibly hard on your kidneys, and I've seen people in their early 90s starting to have kidney failure, and the only factor in it all was the blood pressure, statin, and other medications they've taken for 30 or 40 years.
Exactly. I guess, is that kind of a silver lining? I've seen some great comments, and welcome, Timothy. Wow, good to see you, man. The silver lining is people are going, okay, we got to do something. We can't just sit around and continue to go down this downward spiral.
Well, and my journey started because I run a Medicare agency.
Right.
April will be 13 years at doing this. And we see the problems the doctors are having with making money. Primary care is my passion because the primary care physicians are under attack by having their dollars reduced. And yet they're the first responders in the health system, if you don't count ERs and whatever, but there are the ones we start with for everything we need. And so if we can't make it with primary care, how is the whole health system going to work? So we need to increase the money they're making. We need to make life easier on the Medicare side. And that's one of the things we're going to do with doctors too. We're going to help them make more money, take care of people better, and then get paid better. Well, money and paid better. And their customers stay put and have better outcomes. That's what we're trying to do.
Right.
Mhm.
And it's easier in some sectors than others. But Beverly, correct me if I'm wrong. Didn't you tell me a story not too long ago on your side of the business and that where it did actually help, the rural clinics and
Well, yeah, that's what we were talking about, I think, before I froze up. So with that hospital that was in that rural area, when we went to visit, I think he said he had like 44 patients during the course of a month. And if they were able to, because with the healing for wounds, what we focus on is closing down chronic wounds. So if they have patients who have come in and who've had these open wounds for months, and some of them are like close to years, but definitely months, a long time, and that impacts the family, that impacts the patients, that impacts everybody. It's not just a one, it's several moving pieces. But with that particular hospital, if they have 44 patients and we're able to close those wounds down within 6 weeks or less, what I tell people is the beauty of that is that, so you have a person who's had these wounds open for God knows how long. They're now able to physically see this wound closing. That's going to release some endorphins. They're going to be happy to go back. And because we use that proprietary tool with the Exonics, which reduces pain by 95%, they're not going to go in there with, oh my God, holding back because of the scalpels, because it's associated with pain. I mean, it's like me telling you not to think about a lemon. Those ducts in the back of your neck start swelling up, whether I say it or not. But so now we've removed the pain. Now we're closing down the wound. They're going to go back into the community healthier than when they came out. Now they're going to talk to other people. That's going to help the doctor. That's going to help the patient. That's going to help the community. It's a no-brainer.
Oh, it's phenomenal. I mean, because people said there's a problem, let's go figure it out. And even though you can't fix the system and all the things that go into it, from the nucleus, this makes an impact. You're like, well, if we can get this done and improve care, that's going to have a ripple effect, in the positive. And I love it. That's what y'all are doing. And it's harder. I mean, yeah, if we can wave a magic wand and have the people empowered to do it right, then that'd be great. But until then, let's do this, right? And that's why we're doing these shows. That's why, and I'm already thought of 2 more people to introduce you to. That's why I love doing this, because I'm like, oh wow, I learn something new every day, right? And by the way, Tim, this is your busy seat. You and Santa Claus, right? Like that's like you are all over the Medicare. So do me a favor, Beverly, because I want to make sure people know what you do, because I know they already like you. They already know that you're professionals. You already have people in the wheelhouse. So you do this, right? So you explained a little bit about healing for wounds, but what are the other things, just in case I got lost in the weeds with it, with my country rambling? What other things do you do? So make sure that people, because we got new people here today, popping in. Did she freeze up again?
I tell people to think of it as an electric toothbrush, because it actually does massage that space. That's what we use to clean the wounds with. That's what I like to call the magic sauce. That's what cleans everything out. From there, then we use amniotic membranes, and that's where I love to use the word Star Trek technology, because that's what it feels like. It's like, it looks like a Band-Aid, but it's not. It actually is. It's made from amniotic membrane, and we source it ethically, because where we have our material come from women who are 35 and under. We know that they're going to have a C-section. We work with them throughout their entire pregnancy. So we are all on the same page. That material is harvested, and that is what we use to lay over the wound. And that's what speeds up the healing.
It's infused with stem cells. That's what's really making it heal faster.
And it really makes it more like stem cells 2.0, because a lot of people go, is it stem cells? And we say yes, because it's really 2.0. This is beyond stem cells.
Wow.
So yeah.
All right. So this is the part of the show where I'm going, yeah, like I look like I know what you're saying, but I'm just, I don't even know what you're saying. It
Baz, we call them allografts, Baz. And on the one thing Beverly didn't mention about the Sonics debridement tool is that the standard of care today is a scalpel. 92% of people that we use the Sonics on report 92% less pain, less anxiety. Imagine if somebody's going at your calf with a scalpel, Mike.
Nah, I don't like it.
And here's the other thing. Then we have patient compliance problems, because if it hurt last time, do you want to go in a week from now?
No.
They don't want to. So that's part of the journey of not healing it as well. So if we can eliminate the pain, which we've got a tool for that reduces it substantially, increases healing, and then if one persists more than 30 days, we have something to cure those too.
Tim, that's a good point, because you can't even get me to the dentist, and they got Novocaine and gas and everything. And I'm like, man, I couldn't imagine, that kind of invasiveness and risk. And it raises a good point, right?
Hey,
like,
Walmart's going to be putting dental offices in their
oh,
stores.
Lord, here we go.
And they're going to have a special express lane for those with 12 teeth or less.
Well, you're gonna get me in trouble, but yeah, I know a couple places. I'll just put it that way. All right, so good. And you can't tell a joke backstage. We're gonna ruin it on stage. Okay?
So let me pivot just a little bit. I will tell you now that when we looked at who our people were, we're looking at people who are generally over 65. But they're also very independent. They're used to being very independent and doing their own thing. And now they're at a stage in their lives where this is something that's very different. They're also very conscious about how they're impacting their family, because these are people who've been very independent, progressive, able to take care of themselves, do all these things. And now they have these wounds that not only affect them, but it also affects their family. So these people are trying to figure out how do they navigate now to keep their sense of independence, but also allow themselves to be vulnerable, because this puts you in a vulnerable spot. You're not able to be as mobile as you had been before. You weren't able to get around as easily as you were before. And that impacts you as well as the family.
Yeah, I mean, so we talked about the positive and how people receive this, doctors, professionals. Most people go, wow, the solutions you guys bring collectively and independently is really impressive, right? But is there, and not to be negative, but just to address, elephants in the room, is there leadership wise, what is it hard sometimes to talk and teach professionals to change the way they operate? Like, are there
Yes,
sometimes, yeah,
I think so, because they're so focused just on being a good doctor that you have to get past that gatekeeper. And sometimes the gatekeeper, because I know that when I walk into offices and I'm saying, I'd like to leave this so that you're aware of what you left on the table,
yeah,
after they get over that initial taken aback because they certainly didn't expect to see that number, then they're ready to talk. But again, if they don't know, then they kind of look at you like, oh, you're just another salesperson. It's like, no, if anything, I'm your money angel because I'm here to help you out.
right. And again, then we're bouncing back and forth a little bit. That's okay, because if we go back now, even getting coverage is a hassle. And again, people forget I'm in finance. I don't talk about it because they don't want to hear about it yet. But when I have clients when they turn 65, woo, you talk about mail. They get hit by everyone, everything. It gets really difficult, Tim, to realize what's real, what's fake. And to me, what you guys do and what you do, and this is just something I practice in general. I like to go to brokers or people who operate like brokers, right? So, I mean, think about it. I'm going to go to your website and let you chime in. But the advantage of having someone like Tim when it comes to Medicare, right, is very advantageous, because his job is to go find your solution with all the options available, essentially, right? And help you figure out what you need and what you qualify for. So all these companies are saying, pick us, pick us. You need somebody that can go, okay, that's the best solution, right? And in my line of work, I get paid the same, so I'm picking whatever works for you, just like a real estate broker. You go in and look for an office space. Well, if somebody's selling their own office space, they're going to try to sell that space. If you have a real estate agent, they're going to sell whatever because they're going to get paid about the same anyway. Am I missing that, Tim? But is that the
No,
real
it's
advantage?
spot on. I mean, you're required to handle everyone with a fiduciary responsibility, correct, Mike?
That's correct. I am. Not everybody is, but
We in the Medicare business are not. However, my team behaves in a fiduciary responsibility because that's what I expect of them.
daggum straight. I don't need a license or a law to say to treat people right. We just do it. Right? It's good business.
And just how Beverly writes Medicare too, we're all doing it. And I wanted to add something. She's talking about Star Trek technology. The one where they're leaving the money on the table, we can solve with something called remote patient monitoring. That's what we have. And that's what you'll find under revenuedoctor.com is that stuff. You're showing our Medicare business there. We used to call ourselves the Medicare answer team, but the government says we can't have Medicare in our name. But hey, the remote patient monitoring, it's also chronic care management too, can be done. But you take what they call a healthy selfie, and it gives you your respiratory rate, your heart rate, your pulse ox, your A1C, and your blood pressure, all from a selfie. I mean, it's flabbergasting. It's basically, that old medical tricorder that Bones had.
Yeah, that's what I was about to say. I was like, ain't that something?
Star Trek technology, I'm telling you.
And it's doing this remote patient monitoring means the customer is the patient's interacting with this. It sends a packet of information to the doctor review. That's what the doctor's getting paid for, and it makes them meet their metrics. For instance, this whole effort uses AI and technology and other things like that. But in a clinical trial, the clinic was only getting a 14% conversion on doing annual wellness visits. You're supposed to be at 80.
Wow.
After using this for a year, they got the annual wellness visits to $88, or excuse me, 88%. And it pays Medicare pays $78 on original Medicare for each annual wellness visit. And that's how that 9 million, adds up, is how many patients are you leaving not getting all your quality metrics on? And the reality is we have people like brittle diabetics that are insulin dependent going in to see their endocrinologist or their internal medicine primary care, and they only go in once a year to have their prescriptions renewed. But do you even know what their blood sugar's running in the meantime in those other 364 days? You don't. But this gives you that info. It gets it so you can be ahead of the curve on problems.
So that's why
instead of
Tim says,
reacting to them.
so that's why Tim says they will provide you with the information, or they'll provide the information to the doctor, and then the doctor is able to reach out to the patients so that it appears that the doctor is actually doing more, but he's just brought in additional resources to help him, so that when he reaches back out to that patient's going to say, hey, in the midst of all that stuff that he was doing, he had time to see that my numbers weren't right, and so he called.
And
But that's because he's got the people in the background to do that for him, to set him up.
Yeah. And actually, in that clinical trial, it reduced the clinic's burden on labor by about half a head count for the year. So it frees up staff time. You're getting better results. The other thing is, because the patients are more satisfied, your star rating goes up, and doctors are paid based on star rating, and they're paid. Medicare leads the effort on this, and everybody else follows suit how they pay you. They're all paying you based on Medicare. So it doesn't matter if it's the Affordable Care Act. It doesn't matter if it's a group policy through your employer. It doesn't matter if it's Medicaid. It doesn't matter if it's Medicare Advantage. Medicare, original Medicare, and its star rating is what is beating the drum on how doctors get compensated across the board.
So let me put this out here. So if the people, regular people, consumers, people in the system, if they need help at 65, maybe they're new to Medicaid care, maybe they're just trying to see if they got the best deal. They just reach out to you. They don't have to know anything.
Absolutely.
Just reach out, have a conversation, because you're not selling this, you're sharing it. You're just telling people and saying, hey,
Correct.
Here's your option, because they need it. What they need is a guide to help them figure out what to get. I had this
That's
convo
exactly
with
it.
my dad. I said, Dad, go talk to somebody who knows what you're talking about. And, he's like, well, I don't need nothing. I was like, what do you mean you don't need nothing? He's a veteran. He worked hard all his life. And I said, if there's stuff out there you need to get, Dad, you need to go get it. Right? We need to go find you somebody who knows how to get it. And he was like, okay. And we did. We talked to somebody before I knew Tim. I called him. But we talked to somebody, and boom. And people, especially retirees, especially hardworking Americans, they don't have money to be wasted on this stuff, right? They might have to choose food or this over food. It's serious business. So if you know somebody and a friend and family, even if they're grumpy, even if they're not open to it yet, because he wasn't open to it, I did it anyway. I said, I ain't coming over, so I ain't gonna help you with that project if you don't do it, whatever it took, because I knew it could help them, right? So that's where Tim can shine. Beverly, obviously, will you tell us, is providers, clinics, who is the best people to call you, right? So what kind of problems and what kind of solution?
So yeah, as Tim said, and I concur, it's primary care physicians, because they tend to have a melange of people within their practice. And then I'd say endocrinologist, I would say podiatrist, I would say assisted living facilities. Yeah, those are the
Good.
primary three that I would say.
Good. And it's a conversation, because if you personally can't help them, you probably know people who could, right? And that's the whole network
Exactly.
communal aspect. It's like, well, I talked to Tim, but Tim knows Beverly, and he knows everybody. He knows everybody. And that's where it's good, because it's like talking to me. I'm like, well, you don't need me, but let me go find you someone who is top level that will do you right. And that's why I love seeing this. I mean, that's a viable solution. That's not a Band-Aid solution. You guys are doing it from the bottom up. And I found the right website, Tim. Thank you very much. Solar flare. I don't know if I can blame this one on the solar flare. I might be stretching that a little bit. What do you think, Beverly?
Yeah, I
There it
don't
is.
know. Like I said, when we get together, we tend to blow things up. So
Yeah, no kidding. Well, we have fun. I want to have fun because, again, man, life's stressful, and we're not diminishing that, but have fun and connect, and then we get things done, right? That's what I love about it. So, Tim, explain this again real quick because I want to make sure people understand this portion of what you do. Who should call you and why?
Well, if you'd like to help your primary care doctor by helping them make more money, they can give us a ring, and we can run a report on their actual data from Medicare. We pull it from the Medicare database, and we can show them what the money they're leaving on the table, and we can show them how to recover it.
You got it. Well, I'll tell you what, I'm going to give a shout out to, well, guess who? She's here, right? Beverly. So people who support the Hounds get this message out, connect people, and make this happen. I've seen it happening, folks. So share this with everyone that needs it, and that's pretty much everyone in this country, in the U.S. anyway. So don't be shy. Scan the QR code, or you can go straight to healingforwounds.com. Or if you want to check out and hang out with Tim, you can find him and Beverly Neal Clinton on LinkedIn. Right, that's where y'all hang out because you hang out with me too. So I'm always on LinkedIn. So go out there. There's resources. There's tons of info. But have that conversation. That's all it is. And it could be life-changing, or it could be life-changing for someone you know, care about, and love. So, and real quick, you all know what week this is? I must have been slipping. It's Kindness Week. It's here. Kindness Week. And today, and I'm not sure about the time. I hope we didn't miss it. But the private showing of the documentary for Kindness Worldwide aired today in where it started, the birthplace of kindness, York, Pennsylvania. So, and again, this is what I love about community. You're doing it in healthcare, and we're doing it all across the board because Shonda Spates, right, in North Carolina, the CEO of Flourish Foundation Project, we're not about food, right? We're about youth mental health and well-being and prevention. And she said, man, somebody's got to do something. Kevin Smith said, yeah, we're about kindness. It's kind to feed people. It's kind to help out when people are going through tough times. And then the Hounds, that's what we do anyway, right? So we all went together and started pushing this up. And then you saw it. You're like, hey, yeah, absolutely, right? New Mexico, everybody, all states can get involved with this. So again, go to my LinkedIn profile. It's right on the feature page. If you want to be a part of the solution, help people struggling right now with food insecurity, go ahead and do that. That's what we're for. You can nominate your local food pantry. You can go out there and contribute. We're getting aid directly to the people that need it. And that's what it is. Humanitarian. Simple as that. That's all I care about. Right. If somebody's drowning, I don't ask questions. I just help them. And that's our standpoint. So if anybody, resonates with that, there you go. So thank you, Kevin. Man, he's doing great work out there, and just wanted to give him a shout out. And then have to give him a quick shout out, Curtis Rivers. All right, if you've seen a movie in the last 30 years, you saw this man in it. All right, you didn't know it because he's a stunt man, but he gave up that lifestyle because he wanted to be happy. Yeah, that's who we run with in the Hounds, Beverly. You know that. So, but now at the holidays, this is a real pivotal time. People have business, jobs, they're taking care of everything. And the straw that broke the camel's back usually is in this time, right? Usually Christmas and holidays and New Year. So we're going to be putting out a campaign. You're going to see a lot of folks in the Hounds. You're going to see Beverly here soon. And we're going to give out holiday rescue tips, folks. So we're going to be doing it in healthcare. We're going to be doing it for B2B decision makers, entrepreneurs, everyone. So be on the lookout. People will be posting that across LinkedIn, on YouTube. And these are not designed to be promos. Okay. These are designed to give you tips, and you're going to go, did they say that? Like, did they read my mind? That's what we're after, right? Hey, that's a good point. Thank you for actually putting that out there. So be looking for that. And thank you, Curtis. He's leading the charge on this campaign. So we want to give him a shout out. So if you're going through a life pivot, something's bothering you, if I break a toe, I go to the doctor, right? Same kind of concept. You're just out of whack. You're looking for harmony. Curtis Rivers. All right. And I think that's it. No, last but not least, and if you haven't met this guy, we got to connect you yesterday. So he's got an amazing story. He's a former divorce attorney. His doctor said, hey, you're too fat. You're going to die. He said, you're not listening. You go find a new doctor. So the man went and researched health, put it all down into basics. He's got the 9 golden rules. And honestly, the only program that actually worked for me, partially because I'm hard-headed, There's a lot of nonsense. So the man boiled it down, made it simple for people to operate in, and really falls in line with what we're talking about. Basic just
Exactly.
health. Yeah, drink water, just basic stuff that, and if you're an entrepreneur, Tim, man, it's easier said than done. So he said, drink water. I said, well, I drink a lot of hose water. He said, well, we'll start slowly. At least you're drinking water, Mike. So,
well, I drink alkaline water, and my doctor says I'm very well hydrated.
yeah, well, you look hydrated. You look very hydrated. Doesn't he look hydrated, Beverly?
Yeah, let's play with that word. Okay.
There we go. All right. So let me close out with this question, right? So I'm gonna throw it out there. I'll let y'all fight over because you're being too nice today. Y'all behaving good. But so what's next for Healing for Wounds and Revenue Doctors? How can people and communities get involved in some way within this mission as a general?
Healing for Wounds, reach out to us if you have a family member, a friend, a coworker, someone in your neighborhood who you know is struggling with an open wound. There's no need for that. Not today, not now. Reach out to us, and then we will find a doctor. We're partnering between doctors and patients, and we can help you out, and you can get your life back and be a contribution.
Get your life back. And people, and this is all about people struggling. Some of them suffering through this. I mean, you talked about wounds that's been like decades, and I can't even imagine the relief that would. I mean, they never think I'll be just living with this for the rest of my life, and then it's closing, and the quality of life, and then that eases the burden on the caretakers who have families and jobs. And guys, this is real. So don't worry about people's feelings. Just share it. Make the intro. Let people figure this out. But this is not something I'm going to be hesitant to share. If I know it can help people, I'm going to share it. They get mad if they want to, but that's not what happens. I've never seen nobody got mad introducing you to no one. They all say, oh, thank you, Mike. I said, I'm going to lean in on that, right? So thank you, Beverly, for doing what you do. Tim, it's your turn, my friend. How can communities and leaders and folks really become a part of this solution, tie in with you guys and make an impact together?
Well, we're looking for more reps so that we can get the word out there, because that's the way to get it. We can't do it alone. We're looking for more reps. And, one of the success stories that Beverly is talking about is there was somebody with a wound on their entire calf. 176 square centimeters, something like that. Had it for more than a decade, and it wouldn't heal. 13 weeks, 13 treatments later, this individual was healed.
Wow. That sounds too good to be true, but it's not. That's just what it is.
It took 13 weeks, and it took the allograft to do it. Now, the thing is what we need help getting the word out. We need help doing this. This program on remote patient monitoring is a priority program with Medicare and Dr. Oz at the Center for Medicare and Medicaid Services, known as CMS. They're paying in under 30 days for remote patient monitoring. That's unheard of in Medicare, that they're paying in anything less than 60 to 90 days. So this is a priority program that will contribute to people being healthier and having better outcomes. And that's exactly what the current administration under Dr. Oz wants to do. He wants doctors doing less paperwork and doing more, getting out ahead of a problem as opposed to treating the symptom.
Well, Beverly, Tim, appreciate you. You guys work hard. I want people to know that. Y'all work extra hard, day in, day out, nonstop, going through stuff, because you truly help people. You really do. It's not just a money thing. It's a heart thing. And that's why I'm all behind it, because you're attracting the kind of people that, I'll be honest, I can say it, that we need a leadership. Yeah. So let's keep going. Let's keep going. And
the thing that really turned it around for me was in 2014. I'm in front of a little old lady making about $800 a month, and she's choosing not to eat because she can't afford because she couldn't afford her medications. And I was able to get her medications to zero so that she could eat. And she hugged me in tears. When that's happened, that gets you up and you're willing to go work harder.
That's the battle cry, brother. This is what we're talking about. People aren't talking about it because it's embarrassing. They're busy. Maybe they don't see it. It's out there. Do not be shy. Make connections, make introductions, repost, reshare, email somebody. Hey, it's this time of year. People are struggling with this, but be a part of the solution. Like, I don't have a whole lot to do, but I'm going to share it. I'm going to shout it from the rooftops, and we'll do shows like this, right? And so, speaking of that, all the folks in the comments, man, thank you, and the people watching and on the replays and the reposts. Seriously, we appreciate you. Life's busy. It's the holidays. You come to support, and that means everything to us. So I've got 3 people just talking to y'all today that I need to introduce.
Well, Baz we need to have a conversation with Baz. He's got some interesting questions and insights there that I noticed in the comments. So
don't tell no one, even though we're live. Baz knows everybody, and he just doesn't know everybody. People say I know somebody. My next question is, do you have influence? Because you could know the phone book. It doesn't mean nobody's going to call you back, right? Like, so, but yes, he does. So yeah, he's been very instrumental, and he helps people in a different way. And so this is what I mean. Even people that work with people, in here and here, it kind of goes hand in hand. Because if you have a horrible disease or something that's unsolvable, or you're gonna have issue, right? It's vice versa. And then as soon as you take away and help somebody heal that actual wound or that actual element, or help them treat that, then the mind gets better. It's like telling somebody be happy when they're in chronic pain. Come on now. Like,
kind of hard.
It goes hand in hand, right? And so anyway, love the collaboration, love what you guys are doing. If you guys want to be a part of the solution, you want to share and participate, go to the websites on the screen down here. We'll put them in the chat and the comments so folks can find it easy. And just find them on Tim Moray. Did I say it right?
Tim Moray, yes.
Moray, all right. I didn't mess that one up. Moray, I love it. And then Beverly Neal Clinton. Don't have to do that.
Oh my goodness.
But go plug into these happy, friendly people that are out here making a difference. And thank you for the hard work. And also, again, day after, right? Thank you for your military service and sacrifice, you and your families. Much appreciated.
You're welcome. You're welcome. Our pleasure.
Hey, I'm going to run the outro video. I actually found that one. All right. So thank you for the updates that I didn't know about StreamYard. So have a good one, y'all. Keep me on my toes, StreamYard. Don't get mad at me. All right, y'all. We'll have a next
Thanks,
one.
Mike. Greatly appreciate it.
Holiday tips. All right, we're going to have panels. We're going to have a ball. We're going to learn stuff, get to network with the HOB. We're going to have a blast. We're going to learn. We're going to network. We're going to get ready for the new year. We're going to blast the impact through the rooftops. What do you say?
Absolutely. And Mike, when you're choosing your Medicare, don't buy your insurance on a whim. Call Tim.
Oh, Lord.
Now we can put that on the camo hat. We got reset, right? So I need somebody in merch to call me right now. Call me merch, people. All right, y'all. On that note, I'm out. Y'all be good. Thank you so much.
Thank you.
Thank y'all for stopping by. Be sure to follow, share, and like, and send me a message if you had fun today. Y'all come back now.